Hey, good. Happy New Year to all you ACA and Medicare agents. It is January the 3rd. Man, exciting. I'm going to wait for some of you guys to come join us. Hopefully you get this notification to come join. I've got two big questions that I've gotten from agents that I'm going to be talking about today. One is a Medicare question and one is an ACA question. So give me a minute. I'm getting that ready. I am a little bit behind, came in a little bit late today, but let me pull this up. All right, let's jump right into this. And I am going to share some information with you guys about Medicare 2025. All right, let's do this. While we wait for some people to come join us, let's see here. Man, we're starting off with no viewers, but it's Friday, it's January 3rd. Why would you expect to be doing the YouTube live? Anyway, all right, people are joining in. Please post your comments, ask questions, but let's jump into what's happening with Medicare in 2025. All right, so number one, guys, first thing I want to share with you is the way we've done duals, the way we've handled dual business in the past is no longer the same, guys. Okay, Medicare D-SNPs, it is not the same. So you've got to prepare yourself for you. If your uplines haven't been talking about this, man, it's time that you get a little educated. All right, so understand HIDE and FIDE. All right, HIDE and FIDE. What is HIDE and FIDE? So HIDE, H-I-D-E, highly integrated dual eligibles. Okay, and then there's FIDE, which is fully integrated dual eligibles. Okay, you got to start becoming very, very familiar with those terms and what they are. So HIDE, this is a type of dual SNP with moderate integration. Okay, only exclusively aligned HIDEs need to follow unified appeals and grievance processes. I don't even know what that means, but anyway. And then we have FIDE. This is a type of D-SNP that has the highest level of integration. FIDEs must have unified appeals and grievance process, a single member ID card for Medicare and Medicaid. Okay, Medicare and Medicaid. Think about that, guys. So here's what's happening. Okay, there are, in fact, I am going to share this. Let me pull this screen up so you guys can see it. No, not slides. Come on, present screen. All right. I'm going to share a screen with you. Give me 1 minute here. All right. Present. Come on, get the right screen. Window. Okay, here we go. I'm going to share this screen with you here. Take a look at this, guys. All right. These are the HIDE and FIDE states. All right. So look at these states. All right. Let's see how many we got. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Am I right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Okay, here we go. 22 HIDE and FIDE states. So what this means, guys, this is my interpretation. I mean, I'm learning about this at the same time you guys are. Okay. What's happening here is these 22 states, like Texas, if they have, well, first of all, if you're going to utilize the HIDE and FIDE elections to enroll somebody, the Medicaid provider must match the D-SNP provider. That's all that it means. So in other words, in Texas, if somebody has Molina Medicaid, I got to write a Molina MAPD. I can't put them into a United MAPD or if they have Molina Medicaid, I have to put them into a Molina D-SNP. They have United Medicaid, I have to put them into a United D-SNP. If I'm going to utilize the dual elections, okay? If I find another election, okay, relocation, gaining or losing Medicaid, or gaining Medicaid, a 5-star, a disaster, any other location, I can do whatever I want and put them into a D-SNP. But I will not be able to use Heidi-Fighty, these elections, these dual elections, if I don't match the Medicaid provider to the D-SNP provider. So what if you're in a non-Heidi-Fighty state? Well, then you're completely out of luck. Okay, you got to use one of the other elections to get them into a D-SNP plan. That's what it's boiling down to. Not a good thing, guys. So just the way it is. Also, here's what you need to be aware of. Okay, OEP, we're in OEP right now. OEP is a regular election. And guys, I don't see any comments popping up. If you want to ask a question, post your question on the pop-up, okay, on the comment, please. Okay, but OEP is the same. Okay, OEP is a election. It's a Medicare Advantage election, which means they already have to have it. Okay, they have to have that election. Otherwise, there's nothing you can do. Okay, so they have an MAPD, and you're going to make a change to another MAPD. It's a one-time change. Okay, you can't keep utilizing it. Once it's utilized, you're done with OEP. You can also go from an MAPD to original Medicare. Okay, so know that those are the options. Now, if they have a med sup and a PDP, they can't use OEP to get into an MAPD. So a lot of acronyms I'm throwing out. Okay, here's the other big news with Medicare. Okay, no LIS election for 2025. Okay, remember, people can still have LIS, which is the extra help with the prescription drugs. But we agents cannot utilize LIS in 2025. I know, what are we going to do? Okay. Okay, that's Medicare news. Guys, post your comments. Got a few extra viewers. Thank you for joining us on the live YouTube today. Post a comment, guys. Okay, that's what I have for Medicare. Okay, I'm going to jump into ACA. Good question I got asked yesterday. We are still in OEP for ACA, guys. Okay, so know that. We are in OEP for ACA, which means it's game on. Okay, till January the 15th. All right, so till January the 15th, it is game on. All right, I'm getting out of there. So here is my ACA question. I've got no comments. Guys, post a comment. I'll be glad to answer, okay? Ask me a question. I like questions because otherwise I keep talking. Okay, I got a question from an agent. It says, Luis, can you help me explain ACA gold versus silver versus bronze? Is gold better? Is it a much better plan for my customer versus the silver? You would think so. Okay, if we're talking about metals, not metals, but a gold medal, a silver medal, or a bronze, okay, you should want to be, your first place is gold, second place is silver, third place is bronze. So the initial indication is that you start thinking that the gold plan is going to be better in some fashion compared to the silver and the bronze. So I'm integrating my account right now. Give me 1 minute and I'm going to share that. And I will definitely answer that question. Give me 1 minute. Okay. Integrating my Health Sherpa right now. And I'm going to go run a quote. All right, let me share my screen and I'll demonstrate. And Glenn, I will get to your question. Good question. All right. All right, so you're seeing my Health Sherpa right now, guys. Okay, so I'm going to run a quote. Okay, so I got a female, 35-year-old, making $20,000. I go to this side and I see their monthly savings and cost sharing reductions. So let's just do a quick little analysis. I'm going to stick with one carrier. That way we're not mixing variables. I'm going to go to expanded bronze, which is just like bronze, but with copays. Okay, I don't do a lot of bronzes. I always stick to the expanded bronze. And then also, I don't like this 50% after deductible crap. Okay, try to stay away from it. So I'm going to choose this plan right now just for the comparison. Let's go to silver. Okay. You know what? And then I chose the regular Blue Cross. So I am going to just, Blue Cross. In fact, let's go back here. You know what? Let's just do this. And then let's go to gold. So we're just comparing the metal levels right now. Okay. So I have them side by side. So we've got bronze here on the left, silver in the middle, gold on the right. So you would think gold is better. Okay. Something's got to make it gold. All right, let's just look at the numbers and then we'll think about some misconceptions. So looking at the numbers only, you see that the bronze or the silver in the middle has a premium, but these other two don't. Okay, $18 a month, chump change. Let's look at the deductible. Bronze, $7,500. Damn, that's high. Okay, silver, $0. Okay, not bad for the gold, $1,500. Now let's look at the out-of-pocket. Now the deductible is built into the out-of-pocket for this max out-of-pocket. Okay, so it's not $7,500 plus $9,200. It's this $7,500 is already built in here. Okay, so let's look at the max out-of-pocket, which is the worst case scenario. Well, silver is kicking butt right now with $1,000 max out-of-pocket. Bronze, $9,200, and then you have gold, $78. But I thought gold was better. Okay, again, misconceptions. Okay, the network is the same. Let's look at the copays. Bronze is $50, silver no charge, $30 is for the gold. I thought gold was better. Look at the specialist. Okay, now in this scenario, I'm paying 30%. Maybe I should have selected a different silver plan. But is this bad? No. Remember that once they pay $1,000, if that specialist is $400 for that visit and they pay $120, $120 just went towards that 1,000. Okay. So once they hit the 1,000, they're done. So it's really not that bad. Okay. Maybe look at the labs. Okay. That's all right. Let's look at urgent care. Silver's winning. Hospital. Okay. I mean, all said and done right now, silver is like, you want a silver medal, you want silver. Silver is like number one. But gold must have a bigger network. Now, in this scenario, I screwed it up because I'm looking at the Blue Advantage versus the My Blue. These are actually two different networks. But let's just make an assumption that they're all Blue Advantage. Okay, well, same network. So there's not more doctors. Or maybe they're all My Blue, same network. So you're not getting something more with gold. You're not getting more doctors. You're not getting more specialists. You're not getting more hospitals. You're not getting more. You're not getting more things covered. You're not getting a bigger formulary. Nothing is happening, guys. Okay, so it's a misconception. Okay, let's go back. Now, some of you are thinking, but Luis, Blue Advantage has a bigger network. It does. I screwed up. But if I do Blue Advantage for all of them, then it's gold really doesn't matter. Okay. All right. Let's change this income to 100,000. You know what I need to do? I need to go fix this crap. Okay. I'm going to get away from the Blue Advantage. That way we can do all the same. Let's get rid of all of them. That way they're in order. So let's go here, 100,000. I'm going to compare that my blue. Let's go compare this my blue. And let's go compare this my blue. All right. So income, same parameters, income has increased. Now let's take a look at this. Okay, well, premium, bronze is winning. Forget the deductible, but or maybe not. Gold is winning, lower deductible. Look at the max out of pocket. Okay, bronze sucks, silver second, gold is winning in this case. Let's look at copays. Okay, gold's winning all the way around. Now in this scenario, gold is looking a little bit better. Okay, so why is gold looking better now and it wasn't before? Because the income. So, yeah, now, but remember, again, here's the misconception. They are not buying more doctors. They're not buying better coverage. They're not buying a bigger formulary for prescriptions. They're not buying anything. You would think because it's gold that they are, but they are not. Okay. All right, here we go. Let's talk about it. Glenn, okay, good question. Here we go. And guys, the rest of y'all, hit me with some comments because I'm done. This is it, okay? Don't have any hot topics today. Glenn, who should I call or email for contracting? Glenn, hit me up. I'm going to share my email with you. Okay, just posted it here. I will also put it on the banner. Okay. At least I'm trying to. Oh, here we go. There's my email. So Glenn, hit me up. Okay. All right. So let's go back to your comment here. So Glenn, finally got my email and my check stuff uploaded. Yeah. So hit me up with an email. I'll get you set up for contracting for ACA or Medicare. I'll get you set up with your, for ACA, this is the way I do it, guys. I think agents, ACA and Medicare, two different animals. For ACA, all the ACA carriers in the states that you want to sell, Emeritus Dental and Vision, and Allstate Health Solutions for the indemnity. And when you contract with me, I'm going to put you through the training and you know how to integrate and package sell those three. For Medicare, we do again, three. We do the AMA carriers, we do med sub carriers, and then we do indemnity. And I like using Heartland National. So I'll hit you up with those three. Okay. And then, of course, the certifications you got to get done and other stuff, which I will share with you. Okay. All right. Nico. Man, my boy's name is Nico. Good name. Nico. What do you think about the new changes to Facebook? Oh, shoot. Man, that's a good question, Nico. Right now, it's making our life harder. Okay. This special category, I'm letting the Facebook people, I'm subbing out my Facebook stuff. Our costs have increased. We're not getting as many leads. In fact, we're selling more this year from referrals and our own grassroots marketing that we are from Facebook. What do I think it's going to do? I think it's going to increase our cost for sure. Okay, per lead. You know what? Here's what I'm going to do, Nico, because I'm kind of, I'm not very knowledgeable with marketing and advertising. I'm an insurance agent. Okay, but I'm going to make a video. I'm going to take this question. Okay, I'm going to take a screenshot of this thing. And here's what I'm going to do for you, Nico. I'm going to get our Facebook, the people that I use, I have two of them, to come in and comment on this special category for insurance. I'll make a video and I'll post it out. And Nico, you got my email here, man. If you'd like, I'll send you a direct link to the video. Shoot me an email and say, hey, Luis, this is Nico from the YouTube Live. Remember my question about Facebook ads regarding special category for insurance agents or insurance advertising, and I will hit you up with information on that because I really don't know a lot about that. I mean, it's it's just going to make it tough. It's going to make it tough. Ivan, the Facebook specialists were on a community 2 weeks ago. They were, you're right. But I don't think that they addressed this specific question yet. But I'm going to get with both Shauna and who's our other guy? I'm going to get with both of our guys and do this. So I'll definitely work on that for you. All right. And Tony, let's get in here. I'm selling in one state and I looked into Google ads. Yeah, Google ads, YouTube ads, hell yeah, way more expensive than Facebook ads. But that may be the way it's going to end up going, guys. So you got to, at this point, what you have to do as an agent is you got to look at your ROI, okay, and your cost of acquisition. And I wish I was really good at numbers, but just to do some quick numbers with you. So if you sell one head, we make approximately, depending on the carrier, depending on your contract level, you're going to make approximately $300 a year. Okay, $300 per head per year. Now you don't get it all at once, you get it monthlies. Okay, now if it costs you $100 to acquire that client, the question is that still a good deal? I think so. 150? I still think so. All right, but if it takes you 10 leads, and let's go back to the 100 for simple math. If I run 10, if I get 10 leads and each of those leads cost me $50, $500, and I close one of those 10, that's what my close ratio is. I'm losing money. I might as well not even do it. I'm spending $500 to make $300. Well, I'm not in the business of losing money, right? Yeah, 5-3. I was looking which hand's up. Yeah, that's not a good thing. So my cost of acquisition is way too high. I need to get those lead costs down, and I need to close more. So if I spend that same $500, but I close 2 heads, now I spent $500 to make $600. Oh man, that's still tough because I'm only making $100 net. Okay, remember I spent $500 and I closed 2 heads, so I made $600, and that's assuming they stay with me all year. So at that point, you got to start looking at your supplemental sales. For those 2 that you just sold, are you going to be able to sell them dental and vision? Because that's another chunk of change. Are you going to be able to sell the indemnity product? That's another chunk of change. Are you now going to be able to sell life insurance to those people? That's another chunk of change. Okay, we sell auto and home insurance. We're targeting those people for auto and home. Can we sell that? So maybe I get my $600 cost or $600 income off 2 heads to maybe $1,200. Well, now think about this. You give me $5 and I give you 12. Dude, I think you'll do that deal all day long without any hesitation. Give me $5, I give you 12. Okay, that deal kind of works. So there's a lot of variables that you must consider, and they're going to be very specific to you. They're not very general numbers. They're going to be for you. Maybe you're a damn good closer and you're smooth, or maybe you suck. Man, you can't sell, ice cream to somebody in the desert. And then you're not going to be able to hit those. So it really is going to matter. It's going to be more specifically to you. So, and you know what? I'm going to ask our same thing, Antonio. If you want to hit me up with an email, man, I'm going to make another video on this. I think I'll ask our 2 Facebook or social media ad people that we work with these questions. All right, Glenn, going back to you, Glenn. So speaking of grassroots marketing for ACA, do you cold door knock local businesses? If so, can you recommend some best practices? Okay, so hell yeah. There's a couple of, I did a video where I went to a restaurant, ended up writing 20 plus heads in a couple of hours. Okay, this restaurant owner, we have the restaurant insured. I knew the owner. It's kind of not really a cold knock, but it was, I asked, hey, what are your employees doing for health insurance? Because you don't provide insurance. And they're like, well, I'll let them find their own stuff. Well, why don't you just let me come in? I'll take care of you, the owner, and then just sit me in a corner and just send me every employee. She's like, oh, I can do that. I'm like, perfect. And feed me. She's like, sure, I'll get you whatever you want. I'm like, perfect. And then what I did is the day before, I sent her my intake form. I said, hey, can you print these out and give one to every employee? That way they're going to, if they're married, they'll give me their spouse's info. If they have kids, date of birth, social, I need everything. So what I did in this example is I went in, I took care of the owner. Boom. Okay. I renewed her. And then I ended up writing every employee, just about every employee in there, because they didn't have insurance. Most of them were young, single people. And it was easy. So you take that strategy and just walk and talk. Go to a strip center. Okay. Think about this. Go to a strip center. Okay. And you're going to have small strip. Maybe we'll have 10 businesses in there. All right. Probably 9 out of those 10 are going to be no health insurance. Okay. Mom and pop shops. Okay. They're not going to be insured. So you could go in there and you could literally walk in with this pitch. Hey, I'm a health insurance agent. I help small businesses like you with health insurance at no cost. Okay. To you, the owner, for me to help your employees. Does it cost me anything? The reason they don't have group health is because it costs a lot of money. It costs the employer a lot of money. Okay, just to give you an idea, group insurance, middle of the road group insurance. Okay, for a small business owner to offer group insurance to their employees. Okay, maybe $500 a month, and the employer has to pay half of that. So if a business owner has 10 employees and the premium for the employee only is $500, which is low. I've seen 600, 700. Okay, but let's just go with 500. The employer must pay half of the employee. That's 250 times 10. That's $2,500. That these employers will have to pay every single month. And it's just money's too tight for a lot of these mom and pop small businesses. So they're not going to have it. So you can go on there and say, look, Mr. Owner, I can help you. So let's get you, your wife, your spouse, your kids, let's get you a plan. Okay. And then I can help each of your employees get their individual plans. And you don't have to pay anything. You don't even have to pay me. I'm going to get compensated from the carrier. All I need from you is to give me a little bit of time. Okay. Here's what I'll do. I got all these forms here. Will you hand them to your employees? Tell them to fill it out. Okay. I need all this data. And then let's do this. I can come back tomorrow, whenever your slow time, and I can sit there and if you just give me half an hour with each employee, and please don't take them off the clock. Okay. Because they're that half hour is I don't want the employee to, want to get out there because they're losing money. Keep them on the clock. Okay. If you can do that for me, okay, then give me half an hour with each one and I'm good. Okay. And also part of my instructions to the owner to tell his employees, make sure you bring me the list of doctors and the medications that everybody in your household is taking. Okay. I want to make sure I find the right plan. And in half an hour, I can get all my work done for every person. Boom. Go to strip centers and do that. Okay. Here's another idea. And we're going to start pushing very, very hard for this. Okay. All right. So think about this. All right. Pay attention here, guys. You go to a doctor's office. Okay. Let's just say you go see your regular doctor because you're sick. Have you ever been there in the lobby waiting and seen some of the pharmaceutical reps come in to talk to the docs? Okay. I have. And pharmaceutical reps are very pretty people. Okay. Good looking guys, handsome guys, beautiful women that they hire. All right. I can't compete. All right. These ladies come in and they go straight to the doc. I'm like, all right. So if you think you can compete with those pharmaceutical reps, you're probably going to lose. So here's my thoughts with this. Okay, I got an angle with this one. So here's what you can do. So, and this kind of has worked for me in the past because I did it without the strategy, but here's the strategy. Call the doctor's office. Hey, and don't talk to the doc. He has no freaking clue. Talk to the insurance person at that office. Okay, the one that handles the claims. Hey, Betty, this is Luis. I'm an insurance agent here in San Antonio. I've got a client. Here's my client right now. His name is John. Okay, and I'm enrolling him in an ACA plan. And what I have found, according to my research, is that your doctor, your business takes these 3 plans. Boom, whatever they are. Do your research. Know what they take. Can you confirm that you take these 3? Okay. All right. They say, yeah, we do. Perfect. Now, Betty, there's 5 other companies in San Antonio. You don't take those? Why not? Listen, we don't like them. We don't have contracts, whatever it is. Okay. All right. I'm just curious. So, Betty, here's a question that I have for you. What do you do when you have a patient that comes in and they have no insurance or they have one of those 5 plans that you guys don't take? And shut up and listen to the answer. Probably they're going to say, well, we have to bill them. Hopefully we get paid or we send it to collections, whatever. I'm like, Betty, I've got a solution for you. Why don't we do this? Betty, why don't you tell them to call me? And I will do everything I can to put them in one of those 3 plans. That way, they can see you guys. You keep a patient. You guys make more money, which is everybody wins. What do you think, Betty? Sure. Okay. Well, here you go, Betty. Okay. And this is how this one actual scenario played out. Like, Betty, I'm going to give you my email and whatever. Now, I have my camera to stand so you can't see, but I've got 1, 2, 3, 4, 5, 6, 7. I have 7 sticky notes right here. And I cleaned my desk out yesterday. And I still have 7 sticky notes. So if Betty's anybody like me, she's probably got a boatload of sticky notes. And she's going to lose my contact information. So what happened in this scenario, I hung up. I'm like, damn it. I called Betty back up. Betty, this is Luis. She said, what do you want now? Like, Betty, can I take you out on a date? And she's like, what? I'm like, nah, not that kind of date, girl. I don't know what you look like. And I'm married. But Betty, can we do this? I'd like to come by, bring you and your colleagues some lunch or breakfast. I don't care. You want some tacos? You want me to bring you some salads from Salada, a Chick-fil-A platter? Tell me what you want. Okay. But I want to do a lunch and learn. Hey, let me teach you guys, educate you a little bit about Obamacare if you want. But if you want nothing, hold up here. Steven, bring me the right cards real quick. You have a right card? Go grab you some. Okay, we're out because we've already put some out. But this is what you want to do, guys. You see this little thing? Okay. This is a rack card holder. So he's going to go get me some. But you put rack cards in here, and you put your business cards in here. And go take 4 of them. Okay, you can get these on Amazon. I think they're like $4 or $5 each. You can go get rack cards made anywhere you want. Okay, and your business cards. Your ultimate goal, you don't care about lunch. Maybe you want to meet Betty and put a face to a name. That way you become more real to Betty. But what you're going to want to do is make sure that the people there, where they go and they pay and they check out, that one of these is sitting there. You want to put them in the lobby. You know, there's one where they check in, put one right there. And then in the lobby, the doctors have a nice little lobby there with magazines and coffee tables, whatever. Put this there. Now, here are the rack cards. Okay, it's got all your information on there. Okay, and now you've got a captive audience that you can market to. Now, what if you did that every single day? Go get you a list of doctors and that's your marketing plan. And it doesn't cost you anything. Or maybe make a deal with Betty. Okay, well, one thing we're doing now is we're auctioning off a TV. Okay, I got a TV there. We're going to do a Yeti cooler. Hey, Betty, every lead that you sent me, I'm going to put your name into this drawing. And at the end of the month, I'm going to pull a drawing out. And it's a 55-inch TV or a Yeti cooler or whatever you want to auction off. And now all of a sudden, Betty's got a little more incentive to send business to you. So there's more stuff, but that's kind of what I'm talking about, Glenn. Hopefully that you can kind of get an idea of what I'm talking about there. All right, let's continue. Let's go to Anthony. Hey, thank you. Yes, you're welcome. Great advice. I ended up buying 10 A leads recently. I was hoping to make at least 3 sales. Is that realistic? Yeah, I think 2 to 3 is realistic. Depends. The problem with social media leads is that they die quick. Their lifespan is very, very small. So in other words, if you're not getting into them right now, they're going to forget they even filled anything out. So put yourself in their shoes. You're on your phone and you're scrolling through Facebook. They see your ad. Ooh, I want health insurance. Click, 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 boom. And then they're scrolling and they're like, oh, look, a kitty cat. Boom. Oh, look, whatever. Oh, look, they're going to be on to other things. So while they've clicked on your ad, you have to have some processes in place so that you can get that lead immediately and start working it. So I use a thing called Agent CRM. Okay. And let me post my link to that. All right, here we go. Agent CRM. There's the link, guys. This CRM, I have it tied directly to Facebook. Okay, to the lead form. So when somebody fills out a lead, the data goes straight into the CRM, and then the CRM goes to work. All right. The first thing that it does is sends me a text and an email. It says, Luis, you just got a lead. I'm like, cool. Second thing that it does, it sends the person that just filled it out a text and an email. And it says, hey, John, this is Luis. Thank you for filling out my ad on social media on health insurance. In a few minutes, I'm going to call you from this number. So don't think that it's spam. It's me calling to help you with your health insurance because I've got to gather some more information. Then about a minute later, the CRM calls me. Okay, I don't have to dial. Now, when I get that text, it texts me with the name, the email, and the phone number. And I can click that phone number and call right there. But if I give it a minute, the CRM calls me. And it says, Luis, you got a lead. You want to talk to him? And hit a key. Boom, I hit a key. And then the CRM calls the client, connects me immediately. So before they get to move on to that next one, in fact, maybe they've moved on just a little bit, I am now talking to that lead. That is huge. So I've got that built in through the CRM. Okay. If you want to, there's a link to the CRM. Okay. If you want to, if you get the CRM, it's the same price whether you get it through me or you go direct. But here's what happens. Okay. All of my workflows that we have built for ACA and Medicare, you get along with the workflow for social media leads. So you don't have to go recreate it. Now you get mine and then you customize it for you. All right. All right, let's go back to Nico. Nico, Luis, do you have any retention strategies like a monthly, quarterly contact with a client? Well, hell yeah. I'm so glad you asked because going back to that CRM, what we do is when we make a sale for a client, first of all, remember that we put the client into the CRM, whether it's a social media lead or whatever the lead is, we put them into the CRM as a contact. The next thing that we do is if we sell them, we indicate, and I've got this already built out where we say, hey, we just sold this guy ACA and we enrolled them with Aetna. Okay. Then what the CRM does is for the next 8 months, it's going to email that client and it's going to tell them, hey, Nico, you're enrolled with Aetna. Congratulations. You should be getting your ID cards here soon. Here, by the way, here is the phone number to Aetna customer service. Call them, don't call me. I'm not saying that, but that's what I'm trying to tell them. If you need any help with your plan, call them. Also, Nico, okay, it's vital that you download the Aetna app. Okay, you want to have the app on your phone so that you can get your ID cards, you can monitor your claims, you can check your doctors, you can do everything from that app and pay your bill if you have a bill. So I give them a picture of the Aetna app, what it looks like, and where to go get it. All right. Then the next month, I hit them back up. So I hit them for the next 8 months, Nico, with stuff about Aetna, and then I cross-sell. Okay. I also, part of the process of adding them to my CRM, I tell the CRM whether I sold them dental or vision. I tell the CRM if I sold them an indemnity plan. I tell the CRM if I sold them life insurance. If I answer no to those questions, it's going to cross-sell for me. It's going to start hitting them up with, Nico, dude, I'm going to tell you, you don't have dental with your ACA plan. You need a dental plan. You need a vision plan. Okay. And I do the same thing with indemnity. Nico, you just to let you know, you have a maximum out of pocket. Check your plan, because it can be as low as $1,800. It can be as high as $9,000. I don't know. And I don't want to put any specifics. But Nico, I've got a plan that will help you pay that out of pocket if you're in an accident or you're hospitalized. Hit me back and I'll give you some more information. Okay. And then a month later, I hit you back up. Nico, dude, I'm so glad you got this insurance, but this is not the most important insurance you could have gotten. I mean, I'm super glad you got your health insurance, man. But let me tell you, Nico, the most important insurance that you need to make sure that you have is life insurance. I don't show in my records we've got any life done for you. So let's talk. Okay, it goes on for 8 months. Then that workflow ends, and we're in September already. We're now getting into October. Now a new workflow starts that I call the OEP workflow, which is now going to tell you, Nico, dude, open enrollment starts in November. Better not go anywhere, man. I'm your guy. I'm your agent. I will help you. Okay. If you want to stay put, great. Stay put. But if you want to make some changes, maybe look at another plan, whatever it may be, in November, we can do that. Okay. I don't want you to go anywhere else. There's a lot of rat agents out there. You don't know who you're dealing with. I got all your info already. Okay. I will help you renew with the same plan or with another plan. So don't go anywhere. And then I hit them up consistently throughout the entire open enrollment about getting set up. So yeah, that's what you've got to do, man. Now, you cannot have a CRM and just do it manually. Good luck. Okay, if you have a sizable book of business, you'll never get done. Or go spend $2,000, $2,500 and go hire somebody. Or get the CRM. CRM is $97 a month. Go get the CRM. I'm showing the link again here. Go get the CRM, and you can get the CRM to do that work for you. All right. There's the site, guys. You can go there, agent-crm.com/Luis-Moreno. You've got to go there. Go get the CRM. And again, it's the same price whether you got it or not. And you still have access to everything that Agent CRM gives you. All right, let's continue here. Jordan Colissimo. Jordan, I'm currently new to Medicare. Do you recommend I dive into rewrites or stick with new? Okay, well, I'll tell you this. Every freaking agent wants new to Medicare. Why? Okay, well, their number one is new to Medicare pays the most. It's a full commission, $600 and change. If you do nothing but rewrites, well, then you're getting half of that, and you're getting it as earned. Okay, so there's no way that you're just going to be able to focus on one or the other. Okay, especially as a new agent. So you're going to take whatever you get. Okay, If you get a new to Medicare, awesome. Knock yourself out, man. You get a rewrite, even better. Rewrite them to a plan that's better for that client, and you're done. The issue that is going to be happening in 2025, guys, is that if you're dealing with the dual market, it's going to get way, way tough. I mentioned that at the beginning of here, beginning of this YouTube live, Heidi and Feidi. Okay, these are the new way duals are going to be written next year. So if you're in a Heidi Feidi state like Texas, there are 22 states, then you can utilize the dual election to put them into a plan that aligns directly with their Medicaid. Otherwise, you're out of luck. Okay. So I think Medicare business is going to get tougher to do in 2025 and in the future. Plus, they took away LIS as an election that we could use. Sucks, man. So here are my thoughts, Jordan. I would do what you're wanting to do, but this is going to be the year that you master cross-selling and you diversify. So for your Medicare, you need to make sure you've got MedSups ready to go. You need to make sure you have a dental and vision carrier. You need to make sure that for every MAPD that you sell, that you're also offering an indemnity plan. I love using Heartland National, but GTL is another good carrier. I just don't get any kind of love from GTL. I get a ton of love from Heartland National, so I'm going to push their product. And I've got training from them coming next week. If you need contracts for any of that, hit me up, guys. I would be super, super glad to send you contracting. There's my email. Just send me an email and say, hey, Luis, I need Heartland National. I need MedSups. I need MAPD. So that's your cross-selling that you're going to have to dive into. The other thing that I think you're going to have to dive into, Jordan, let me go find your comment here, is I think you're going to have to dive into diversifying. So since you're already doing Medicare and you're ready to go, are you also doing ACA? Now, ACA, I do a lot of new to Medicare because I don't have a marketing, I don't have like a pot of gold at the end of the rainbow that feeds me new to Medicare. Oh, but I do. My rainbow is my ACA book of business, my P&C book of business. As those people are turning 65, I have a workflow. Here's another reason why you want to get my CRM, guys. I have a workflow that's called the Turning 64 and a half workflow. And what it does is it notifies me of anybody that's turning 64 and a half, but it also works with that insured, sending them text and email, preparing them for Medicare, and then I'm going to help them out. Okay, so consider doing ACA. If you don't have a partner for ACA, or you're looking at it, I can help you out. Not only will I help you with contracting, but I've got an 8-week ACA course that I put all the ages to, and I recycle that course. I stopped teaching ACA and Medicare during OEP, but it's almost over. I think in February, I'm going to start a brand new class. So if you don't have ACA and you want to hop into it, connect with me. Anthony. Okay, perfect, man. You'll come back. Great, man. I'll have this recording up later today. Iluhu, Angela. I butchered your name. I'm sorry. Do you hire assistants to service ACA? I have a book of almost 5,000 ACA clients, and it is run by me with everything that I'm doing, and one full-timer and another guy who does very well, but he also does a lot of other stuff for me. He's kicking ass with life insurance. He does P&C. So no, I don't hire an assistant. I have an assistant that costs me $97 a month, and it does a lot of the automations that I have built out. Now you can hire virtual assistants. Okay, they can call your clients. They can help you cross-sell. Virtual assistants. I tried getting with a couple of people and trying to get virtual assistants to help ACA. There's plenty of them out there. Just go research VAs. If you want to hire a VA, you can. But A VA that's in another country is going to be cheap, maybe $10 an hour. If you hire an assistant here in the US, well, you're going to pay $18, $15 an hour. It's going to cost you. Okay. I find the cons anything ranging from choosing the PC. Yeah. So here's the deal. Okay. The reason the clients are calling you is your fault. You haven't trained your clients. Okay. And you make no money dealing with PCP changes and claims. And on top of that, you probably really even can't do anything about it. You're spinning your wheels and it's preventing you from doing things that make you money. So you need to train your clients. That's what my CRM does, is that it tells my clients, look, don't call me. Dude, I don't want to change your PCP. I don't got time for that. But you know what? The carrier has staff that will facilitate that change for you. I can't look at your claims. I can't adjust your claim. I don't know what the hell's going on with your claim. Don't be bothering me with that crap, Mr. Client. But what you need to do is call the carrier, get to the claims department, and they'll explain what's going on. Okay. Now, I can help you with a provider search. I don't want to. Okay. I can help you with medications. I don't want to, because then I become that guy. I got better things to do. So I'm going to blame you. I'm going to use your Angela. I'm going to blame you. You have to train your clients to stop bugging you for this crap. Okay. Tell them. Okay. I like to throw the word HIPAA out a lot. HIPAA. Well, do the HIPAA, whatever. And everybody knows HIPAA. But you know what? Here's what you got to do, Mr. Client. Take your card out from your wallet. Okay. There is a customer service number. Flip it to the back. There's a 1-800 number. Call it. Oh, but I'm sorry. It's the way it is. You got to call that number. Okay. And they will help you with what you need. So train your clients. All right. Do you hire assistants to service? I feel like call me from selecting their PCP to yeah, same question. Super tedious. I agree with you 100%. It drains the life out of you. You don't want to be doing that crap. We want to keep selling policies. So again, it comes down to training. Okay. So part of my CRM and part of the workflow that we created is me training my client. Don't call me. Call the carrier that we enrolled you with, that you selected. They will help you. Most of my clients are Spanish-speaking immigrants, so they need, well, that you know what? Here's the deal. Okay. You know, this is what sometimes, you know, they handicap the hell out of themselves. Okay. They need to start helping themselves out. It's okay. So they have, now, if you were to tell me that they speak just one language that is rare, I could be like, oh, okay, maybe it's, you have to. But Spanish? Really? Everybody speaks Spanish. I mean, well, not everybody. Every carrier has a department that's Spanish. Okay. So they can do it. They just don't want to. They're gonna use you as a crutch. So you need to tell these people, look, you need to help yourself. Come on, man. You're in the US. You got to help yourself. Quit using other people to do things for you. Either they're lazy or they don't want to. Now, a lot of times they don't know how. So you have to help them. How do you help them? Look, get your card. You have your card? Yes. Okay. Get your card. Flip it. You see that number in the back? Call it. 1-8. Okay. They can do that. And then listen. Because most of the companies I call, English or Spanish, hit 2 for Spanish, whatever, and you can go down that Spanish route and they can get the help in Spanish. They just don't want to. They'd rather have you do it for them because that's easier. So train. All right, Jordan. All right, let's go to Garland. I'm not licensed in New York. Man, New York sucks, dude. In fact, I think we only have 1 or 2 carriers in New York. Yeah, New York. I think you're even a state-based exchange. Yeah, you are. And we only have, the organization that I'm partnered up with, we only contract agents up there with Blue Cross Blue Shield. with Anthem Blue Cross. So, yeah, New York, at least for me. But if you live there, hey, you got to rock and roll. You got to do what you got to do. Does Heartland cover New York? You know what? Let me find out. I don't know if Heartland is in New York. Okay, I'm logging in. Give me a minute, and I'll go on to the next question. All right, let's go to Diaz068. What happens if your client goes to a physician that isn't their PCP? Very good question. Give me 1 minute. Damn. Okay, going back to Garland. I do not see New York with Heartland. Probably here's the deal, is that your Department of Insurance, like California, doesn't allow indemnity funds. That's going to be my guess. But I see nothing for New York. All right, Diaz, what happens? Good question. Here's what happens. They're screwed. Okay, so if we're talking about Medicare, these people will either have an HMO or a PPO. If they have an HMO, they're assigned a PCP or they choose one. Okay, but the PCP has to be in the network. So they have to go to the PCP. And then that PCP is the gatekeeper for them seeing other doctors, other specialists. Okay, so if they decide to go to a different PCP that is not the one that's on their card, they can, but they're going to pay for it. Insurance is going to say, nope. If they decide to go to a specialist without the referral, they're going to pay for it. Okay, now if they have a PPO, we're talking about Medicare, guys. They have a PPO, they don't need referrals anymore. They can go wherever they want, but the cost to go see doctors is higher on the PPO. And they can go to out-of-network doctors too. And so they've got more flexibility with the PPO, but with that flexibility comes with having to pay more for medical. Now, if we're talking about ACA right now, guys, at least in my area and what I'm aware of, there are no PPOs. So you either have an HMO or an EPO. And the difference is this. You are assigned a PCP. You pick your PCP, okay? And then that becomes your PCP. Again, you go to a different PCP, you're screwed. Pay for it. You have to go see your PCP. If you're in an HMO, and there's some exceptions to this, there's always exceptions, but if you're in an HMO, you got to get a referral to the specialist. Otherwise, you're paying for that specialist. There's one carrier that is an HMO, and I think it's Molina. They don't require referrals, but the specialist still may require a referral, but the carrier may not. Now, in an EPO, it's still a closed network. You have to go see the PCP, but you don't need referrals to see specialists. So make sure that they're seeing their PCP. If they want to change PCPs, they need to notify the carrier of their new PCP. And you can help them to make sure that other PCP that they want to go see is in the network. Okay. Now, what if they're traveling? I had that call yesterday. A client called me. It's like, hey, I'm going to Georgia for a couple of weeks. Can I go see a doctor over there? I'm like, no. They're out of network. So you can do two things. You can have emergency care or urgent care. But you can't go to another PCP over there in Georgia. No. Okay. Well, how do I find a PCP? Oh, how do I find urgent care? Good question. Get the number back of your card. Call that number. Now, I could search for them, but I don't want to be that guy. I'm like, hey, when you're in Georgia, here's what I would recommend, because you don't want to have that in an emergency, you go wherever. Everything is in network in an emergency. But if you want to go to an urgent care, maybe you do a little advanced research and you look at the urgent care clinics that are in your area. Call that 1-800 number. Or guess what? If you download the damn app, Mr. Client, everything will be on there for you. All right. Garland, let's rock and roll. Angela, because I can't say Elihu. I don't even know if I'm close. You're welcome. Do you have a link for the table mats? You know what? I do. You know what? email me. I'll send you the link that lady gave me, and then you can connect with her. She does do all over the country. I'll send it to you. Shoot me an email. She makes my table mats, my covers for the table. She makes these rack cards. She makes my business cards. I have roll-up banners. I have signs that go out there in my yard, in my front office. So she does everything for me. Everything's already templated, so there's no charge for you guys to, these printers charge you a creation fee and then the cost. Well, I've already paid that creation fee. All you need to do is just pay for whatever you're going to order. All right, Kareem, Happy New Year to you, man. Starting off on a great New Year so far. Diaz, thanks for the clarification. I know with customers can also create their account with carrier's website. Yes, so have them create their account on the computer, on their desktop, laptop, but also, who carries that laptop with them all the time? But they always have their phone with them, always. So make sure that they download the app for the carrier. Kareem, do you coach new agents? Hell yeah, I do. Okay, now, I do for ACA and Medicare. Final expense, man, I wish I could say we are going to be doing more life training. This is the first year that we qualified for a life insurance industry award, $1 million roundtable. We sold 132 applications, or 134 in 2024. We did really, really good, the most we've ever done. Do I consider myself really an expert in final expense? No, but we are, because 2025 is a year of cross-selling. We are going to be bringing on more trainers for final expense. So that is definitely coming. All right. So be prepared for that. But yeah, we're doing that. Nappy the plug. Happy New Year. Appreciate it. I'm glad to help any way I can. All right, guys. I am off. I've got to go finish payroll. My people got to get paid. They keep looking at me through my little window in the door. They want their money. Got to pay my people today. I didn't get it done yesterday. But so glad you guys were with me. A lot of you hung in there over an hour. Damn. Hey, thank you again. So guys, a couple of things I have for y'all. Okay. If you're one of my agents, I do a ton of training for y'all, support. I have a school platform. But if you are out there, guys, in an island by yourself, you got contracted with a carrier and they're just leaving you out there all by yourself. And you're like, man, I train my agents because I've contracted them and I make a little override money. But if you're contracted with somebody else, see, they should be doing their job. A lot of these organizations don't. So what we did is we created this thing called the community, the ACA and Medicare community. And I will share the link here. This community, guys, it's $50 a month. All right, we got to make a little money. But what I do with my regular agents that are underneath me, I do in the community and then some. Okay, so let's go to the community. All right. So you are looking at, let me make sure. Yeah, you're looking at the community. So come join us, guys. This is what we do for you guys in the community. Okay. So if you've got quotes, you're like a new agent. Hey, how do I do Medicare, ACA, whatever? Hit us up. We'll quote it for you and we'll record it and then share it with you. Okay. Right now I'm doing weekly masterminds. We were going to go to monthly, but I really like the weeklies. So I'll probably continue doing weeklies. Okay. We share our ads that we're running, our posts that we're running. I'm really using a ton of AI right now. Okay. So I think it's going to be the way to go. It's going to replace staff, which is a good thing because AI is pretty damn cheap. Okay. So how am I utilizing AI? to help grow my business is what I'll be sharing with these agents in the community. I'm also bringing pros, okay, financial pros, tax pros, business planning pros to come share their knowledge with you guys, okay? Because remember, we sell insurance, guys, but if you're not doing business planning, if you're not handling your taxes, if you're not saving for retirement, you're never going to get out of this gig. You're going to have to do this forever. So we're bringing on some of these pros to talk about things that can help you run your business, okay? We share a lot of lead gen stuff with you guys. Carriers I'm bringing on, come talk about their products. Compliance, when it's time for recertification, I'm going to give you all answers, okay? And then any kind of stuff that I'm able, tech stuff that I'm able to get at a discounted price, because we're going to share it with you guys. I'm going to share it with the agents in the community. And then lots and lots of cross-selling workshops. So come join us, guys. It's $50 a month. Just click on here. And, you know, it's a little bit. I mean, it costs money, but you know what? It's just what we do, guys. But if I can think about this, so you pay $50, it's $600 a year. My goal, if I don't get you that $60 because of the stuff we provided, you were able to sell 1 new to Medicare or 2 ACA heads. That's it. The entire year, man, I just completely failed. That's all you've got to do. If everything that we provide you here, so it helps you sell 1 new to Medicare or 2 ACA heads, this measly $50, you broke even. But that's not my goal. Of course, I want you to make a heck of a lot more. So consider joining us, guys. I'd love to have you guys there. All right. Happy New Year, Atleti. Happy New Year to you, Kareem. Finally, I contracted with an FE carrier, and I'm looking to team up with an experienced agent. You know what? I do have a team of agents in El Paso, and they are kicking ass. This lady and her team of lady agents, well, they got guys on the team. I just say they're a team of agents. They're whooping some butt. So Kareem, email me. I'll see if I can get you hooked up with them. Posting again, my email, Luis@360 Insurance Group. Come join us. I'd love to have you guys there. And then again, my plug here, if you don't have a trainer, if you'd like to work with me, if you like what I provide, guys, and you don't have ACA contracts or Medicare contracts, email me. I'll get you set up and I'll plug you into all of our training. Our agents are making money, guys. Okay. So we can help you get set up, and everything that I'm doing, I'll share with you. So with that, I got to roll, guys. Thanks again for today. Enjoy the first weekend of the year, and we'll see you guys back next Friday. Thanks again. Oh, forgot. Please subscribe if you're not a subscriber. Help me grow this and share my channel, guys. Share it. Help me grow this. We're almost at 7,000 subscribers. Please subscribe if you're not a subscriber, and then share my channel. Thanks again, guys.